It's time for another podcast by George. Straight talk, straight from the heartland, that'll have you saying, "By George, I think he's got it." Now, here's George.
Hello, hi, how are you? And welcome on into another podcast by George. God, I love doing these podcasts, love doing these interviews. I mean, nobody likes being sequestered in Memphis. Nobody likes being shut in. I mean, the self-quarantine's hard on everybody, but I do get to talk to some really informed, intelligent, and interesting people, and that's the case today. Joining us on the podcast by George Liveline is Dr. Andrew Nish. Now, you've heard him on the podcast before, and he is the John Stoddard Cancer Center medical director. And we had him on before talking about a real area of expertise that he lectures on, which is the mind-body connection, which is just fascinating stuff. But I also think it's got a lot to do with where we're at today. We're going to get into that a little bit. And I couldn't be happier to have him on the podcast because, like I tell everybody, don't get your information about this pandemic from a podcaster, and you probably don't want to get it from a pontificating politician either. You probably want to go to medical people. I mean, that's the source. And when this thing started to sweep across the country, I thought, my God, I got to get the doc on. I got to get Dr. Andrew Nish on the podcast and see what he thinks about all this. Of course, they were real busy, and he still is. And again, that's why I'm extra happy that he's on the podcast today. Good morning, Dr. Nish.
Hey, good morning.
Thanks for coming on.
I didn't come on earlier because I had a respiratory illness and literally couldn't talk.
Oh my God. Did you have any concern at the time that it might be COVID related?
I really didn't, because the complex of symptoms didn't match at all.
Oh.
And there were multiple people around me. I was actually out skiing, and nobody got sick. So I don't think I had it.
Well, I'm glad, and I'm glad you're here today. And I'll just kind of proceed like a typical man in the street type of an interview and just ask some open-ended questions because I'm too dumb to get too specific. But where do you think we're at? Where are we at right now with this?
Well, it depends on where you are in the country, from where you are in the world. So, it's as a country, we continue to see increasing cases every day. We continue to see increasing fatalities. Iowa yesterday just reported almost a doubling in the number of cases. A lot of those came from a meat packing plant. So we still have not hit our peak. Different projections, different models. We may hit our peak first part of May. Not sure. I mean, it changes every day. And that's the thing about this whole virus is it is unpredictable, and even models have not been very reliable. So the bottom line is we are still increasing the number of cases. We still need to practice what we've been told by the medical experts. And I want everybody to remember, this is not a political problem. This is not an economic problem. This is a medical problem. And that's where our source of information should really come from. So we need to continue to practice social distancing. We need to continue to practice really good hygiene and hand washing. And we need to minimize trips that we don't need to make. So essentials for groceries and medicines, okay, but that's about it.
Yeah, and that's what I'm doing. My wife, as I've mentioned on the podcast before, does have an underlying health condition. And so, I'm doing that just to protect her, and everybody needs to do that. And to put it in layman's terms, I tell everybody here in the heartland, we're just walking into this. I know folks are getting antsy, and some people have been quarantined for a while like myself, but here we're just walking into it. In New York, as an example, they hope, at least for the time being anyway, that they're walking out of it. Well, Doc, a lot of people, myself included, were surprised by all of this. I mean, this has been talked about a little bit, the potential for pandemics and preparations and that type of thing. But did you, in your career, did you have any inkling that something like this could or would happen, particularly to this degree?
Yeah, that's an interesting question, because in our health system, we're so focused on treating all these chronic disease, and we sort of ignore this whole thing about pandemic. But if you go back and read for the last 4 to 5 years, people have been predicting that we are going to have a pandemic that could be as bad as the 1918 Spanish flu. Bill Gates runs the Bill and Melinda Gates Foundation, and he's been talking about this for several years now. that there will be another pandemic. It's only a matter of when, and the when is here. So if you look at different organizations, they have been predicting this. Governments have kind of really been ignoring it, particularly our government. We got rid of stockpiling protective equipment and really didn't prepare for this whatsoever. If you look at countries in Eastern Asia, for example, Singapore, China, Hong Kong, Taiwan, they've been through this before. So they went through this with SARS. So SARS happened a number of years ago. They saw it was a much deadlier virus, had a much higher case fatality rate, didn't spread as rapidly, but they were prepared for this. So they were prepared to put people on lockdown. Their health institutions were prepared to quarantine and really clamp down on getting people into the hospital in a really efficient and effective way. We had no such preparation. So hopefully we learn from this. So we kind of have two phases. We have this acute phase where we're trying to scramble and treat people, but then we have to look to the future, and we have to look to how do we better prepare our society for another pandemic, because it's going to happen. There's no question about it. With the density of population that we see in the world today, we're seeing cities of 30, 40 million people in impoverished areas. With the international air travel, these things will happen again. They will spread rapidly again, and we have to be much better prepared.
Agreed. And of course, my great fear is that, everybody's fear, I suppose, and this is a worst case scenario, but some people might be, that this is the new normal, that we're going to be walking around with masks and gloves on the rest of our lives. My God, that's got to be science fiction-y. I hope that that's not true. Well, you're the cancer doc. I mean, this is, we talked to you about the mind-body connection before. A couple of questions about that. Now, as far as people that are recovering from cancer and needing treatment, particularly in what you've heard from these major hospitals, are these folks being taken care of, the cancer patients, in the middle of this pandemic? And is it possible to take care of them as well as they need to be during a pandemic?
So the answer to your first question is yes, we are taking care of our cancer patients. So patients who are already in their treatment regime, whether it's chemotherapy, whether it's radiation therapy, are still getting their chemotherapy, they're still getting their radiation therapy. We're taking, strict precautions at, when they come to the office, that they're getting their temperatures taken, they're getting a thorough history taken before they're even allowed in to intermix with other people. New cancer diagnoses, now that's an interesting question. So the American College of Surgeons, we've looked at stratifying people for surgery or withholding surgery. So right now in Des Moines, Iowa, at least at Methodist Medical Center, we are in what's called phase 1. Phase 1 means we are prepared for an influx of coronavirus cases. We don't have that many. We only have 22 people in the hospital right now with coronavirus. So our cancer patients who have cancers that really can't wait 2 or 3 months or their prognosis will change are being operated on, are getting put into the system. Now, if somebody has a cancer diagnosis where we don't think that their outcome will change in the next 3 months, they may be delayed for a couple months. We have canceled all elective surgeries because we're trying to conserve on protective gear for people. So really it's urgent and emergent surgeries only. But if you came in with an acute leukemia, you would be treated just as if this wasn't going on.
Wow.
Yes, we are open for business. But again, our practitioners are using telehealth, and I think we're going to learn a lot about this. And so instead of having everybody come into the office, the majority of people are being seen over a teleconference, just like you and I are doing. And I think we're going to find this really effective. And it may, I think, fundamentally change how we care for people in the future.
Well, that kind of leads me to my next question, because this self-quarantine, and we've been doing it here in my house for a few weeks now. Doesn't bother me too much. I'm an old farm boy. I kind of grew up self-quarantined, or not exactly because I wanted to be, but that's just what the circumstances were. So I'm kind of all right by myself. Now my wife's a much more social person. It's hard on her. Now, talking about your patients as an example, and you're big on this mind-body connection. Obviously, we want to prevent COVID from spreading, but what about people that are not maybe as well prepared to self-quarantine from a mental perspective? Are you concerned about that?
Yeah, we are concerned about that. And so we're really looking at how do we do our support groups with Zoom. So we're going to start Zoom conferencing support groups next month. I've been putting out short videos on our website about what people can do to really thrive in this environment, because it is different for people. We're social beings. As a human species, we're social beings. We do not want to be isolated. Well, now we're sort of isolated. But here's the really fun thing about this. I think this gives us a great opportunity to really take a deep dive inside of ourselves and really look at what's important in life. Because typically we're so busy running from here to there, we aren't aware of us and how we feel about things. And this can bring a great opportunity for awareness of yourself, awareness of your actions and interactions, awareness of how you feel, awareness of what you do, awareness of the environment around you. So I think it presents a tremendous opportunity. And one of the things I've observed is the number of people who are outside.
Yes.
I go outside and there's people walking everywhere. And I think it's tremendous because they're enjoying nature. They've slowed their lives down a little bit, and now they can actually be aware of what's around them and enjoy that. So I think there's really, like I said, a tremendous opportunity for people here. And some people are going to be more adept at it than others. I love this. I thrive. Every day I meditate, I do my yoga, I spend as much time outside as possible, and my life is just slowed down. So I can sit and stare at a beautiful wildflower for 5 minutes. Okay, that's life. So I think we're going to realize that life is not about going to the mall or buying the next best thing. Life is about self-awareness, awareness of the beauty of the earth, and really the awareness of the relationships that we have with one another.
Yeah, that's great. I remember hearing your presentation, and I was particularly struck by the forest bathing part of that. And people are getting outside, and it's good for them. It always reminds me of my cat. He's old. He's 14 years old. He always wants to go outside. I'm like, what the hell do you want to go outside for, man? You're too old to do anything. He'll just get outside and just, he knows that it's good for him, I think. He benefits from that. I think that some of this desire to get outside right now, it's kind of a self-preservation thing with humankind. They know that it makes them feel better and it's good for them, and people are getting outside. And I agree with you. I think it's good for the mind, but most importantly, maybe, good for the mind, obviously, but that it's good for the body. It's good for the physical component also, right?
Yeah, it's two parts. What's good for the mind is good for the physical component, and what's good for the physical is good for the mind. So it's a symbiotic relationship.
Yeah.
And just being outside and exercising is good for our mind. But being in nature where we're absorbing everything it has to offer, the smells, the sounds, the touch, the feel, the visual, all impacts how we feel. And most importantly right now is it impacts our immunity. So we know immune function gets better with beautiful natural environments. And so the more we can be out in nature, or the more we can bring nature into our homes, i.e., look at, the better off we are. And so we may talk a little bit later about strategies to cope with this. And I'm going to talk a little bit about bringing nature into your home, because we're all at home more, we're all working from home. And how do you bring that environment into your home to improve your health every day?
All right, great. I want to get to that. I wanted to get your take on just another thing that I've been hearing about. I know you're a doctor, and obviously your patients come first. You're not an economist, but I know you're a smart guy, so you have to be sensitive to wanting to reopen the economy, get people back to working again. I heard a proposal the other day that maybe we can come up with a test that, like they call it a rapid test or something, where people can be tested very quickly and then maybe verified as being free of the virus enough that they can like enter the workplace for the day, or maybe go to a major event where other people are at. Does that sound like a realistic option to you? Do you think we'll ever be able to test that quickly and efficiently?
Yeah, I think, this is the real problem. We were so far behind the curve on testing. I mean, we couldn't test anybody. And in fact, when I had my respiratory illness, I called and said, hey, can I get tested? Nope, you weren't high risk. You didn't travel overseas. You weren't exposed to COVID. Can't test you. So we now have the capability down at our hospital to test, I think it's 400 people per day. So we have really ramped that up. We have a machine. We do batch testing. So if you get your test put in the morning, we may have that result back within several hours. There are some rapid testing which are literally instantaneous, and we don't have that available here in Des Moines. And I think mostly it's sort of experimental. But if we can come up with a very rapid testing and we can implement that testing on a population-wide basis, then we can maybe begin to open things up. But I don't want we need to be doing this very, very, very slowly. So we need to open up essential services. Well, we've defined those as grocery stores and pharmacies and things. And maybe we expand that a little bit. And maybe we expand that to even maybe small restaurants. I don't know. I don't think, George, you're going to see large gatherings such as football, baseball, basketball games for a year to 18 months. Because we just can't put 20,000 people in a stadium and expect every one of those persons to be COVID free and be tested. So as far as those large public gatherings, until we develop a vaccine, which may be 12 to 18 months away, you're not going to see them. Some people are predicting no large public gatherings, such as sporting events, until 2022.
Yeah, my God. And I'm glad you mentioned that. These things are kind of going along my line of questioning. Maybe the last question I had before we talk a little bit about bringing this outdoors inside for the benefit of folks that need it right now. You mentioned the vaccine. I've been very skeptical of that. I look at that and say, what the hell? They're talking about a year, 18 months to get a vaccine. Everybody's, yeah. Well, we don't have a vaccine for the common cold. We've been working on one for the flu that covers all the flu strains forever, and that's not available. What leads anybody to believe that we're going to, other than we want it very badly, that we're going to have a COVID-19 vaccine in a year or 18 months?
So the common cold, there are infinite number of strains of a lot of coronavirus that cause the common cold. Right now, the COVID-19 virus is a single virus. And if we can develop a vaccine to that virus, it may be very effective. Now, if that virus mutates, all bets are off. So that's the whole rub in this. The same thing with flu. The CDC, Center for Disease Control, tries to predict based on modeling what's going to be the most likely strain of flu the next year. So we're always predicting in the future. Sometimes we predict it really well and it's 70, 80% effective. This year it was about 50-50. So yeah, you're right. There's no guarantee that a vaccine is going to protect 100% of the people. Just not going to happen. And who knows what this COVID-19 is going to do. It may mutate into something different that we have no protection for. So that's why it's so important that we don't start reopening things so fast, because if we do, we're going to see a second spike, we're going to see a third spike, and we may see a mutation that all bets are off again.
Wow. So. But we most likely will see some type of a vaccine in a year to 18 months. It's just how much of it covers, and like the flu vaccine that you talked about, what the percentage of success is. Well, I try to hold my podcast about a half hour or so, and I'm already running out of time, but I did want to get your RX. I wanted to kind of get your recommendation to kind of make folks feel better here that are shut in and self-sequestering here into the COVID-19 environment. Talk a little bit about that, if you would.
I think the biggest thing for people is what their mind does all day. Their thoughts are racing. Oh, I'm going to die. Oh, I'm not going to make it. Oh, we're going to, the economy is going to collapse. So we have this fear because our instinct as humans is survival, right? We want to survive at all costs. And I ask people to ask themselves a question. And this question is, you can ask yourself. And it's, as an absolute truth, as you sit here today, at this moment, is it true that you are not safe? As an absolute truth, is it true that you are not safe? And that's a yes/no question.
No, I'm safe here. Yeah.
Yeah. And the answer is no most of the time. That most of us feel, if it's an absolute truth, we feel safe. But if you watch the news continuously, there's no way you feel safe.
Oh, yeah, I know.
So it's really what our minds do that leads to what I call dis-ease, DIS/EASE, not at ease with your life. So I think it's most important to develop a practice, a meditative practice, a contemplative practice, a mindfulness practice, where each day you can sit with your thoughts and acknowledge those thoughts and then let them go. Because thoughts are just something that our brain does, and we constantly react to those thoughts. I'm not safe. I live in fear. I live in anxiety. A meditative mindfulness practice doesn't get rid of those thoughts. That's not the goal. The goal is to accept that thought as for what it is, a thought, and then just let it go. Most thoughts have nothing to do with reality.
Yeah.
And so we have to be at ease with our thought process and not continually react to that thought. So that's one thing I think people can really do. And then, look at yourself, look at your situation in life, and really give gratitude for what you have today. A lot of us has lost things, I grant that. But we still have an abundance for most of us in this country. So give gratitude for the breath. Give gratitude for waking up in the morning. Give gratitude for that food that you can still put on the table. When you give gratitude, you change your whole perspective on what goes on in life. Because we're always thinking what I don't have. Well, let's give gratitude for what you do have. Because when you look at life as something that you don't have in this or that aspect of life, what does that lead to? Stress and anxiety. When you look at things that you have, what does that lead to? Joy, gratefulness, gratitude. Very different emotions that cause us to feel very, very differently. Yeah.
Oh, man, that's great. Well, I always give my guests the last word, but those are the last words, right? That's great.
I want to go through the healing spaces.
Yeah.
Because I want people to be able to take their home and take it from a non-healing to a healing space. And so how do we make our homes healing spaces? If you have an in-home office that you're working from, make sure that you're near a window with sunlight. Don't bury yourself in the basement. Sunlight and views of nature are particularly calming and healing. So put your office near a window. What you hear, we forget about what we hear. So if you're hearing jarring, loud noises all day, find a place where the noise level is calm, or open the window and listen to the birds, listen to the wind, listen to nature. Again, very calming. What you smell, we forget about smell. So what I tell people is, remember a smell from childhood that made you feel really good, and maybe duplicate that smell. Maybe it was the smell of pine. Maybe it was the smell of baking cookies. Those smells can be incredibly helpful at calming ourselves and just giving us a sense of comfort. And the other thing about air is, don't confine yourself to a small room, because as we breathe out carbon dioxide, as that carbon dioxide accumulates in air that's not moving, we become sleepy, we don't think as well. So open windows. It's a perfect time of year for this. Open the windows, let the breeze come through, enjoy the sunshine, and really breathe in that fresh air. And then again, as we've talked about, spend time in nature. if you're working from home, get up off your desk every hour or even every half hour and go outside for 5 minutes and enjoy the sunshine that's now out. And it'll boost your mood, it'll increase your productivity, and it'll make you feel better.
Yeah. And the boss won't care. He ain't there. So yeah, go do
Looking over your shoulder.
Oh, that's great. I mean, that's why I wanted to have him on, folks. Now, I've done a lot of podcasts here during this COVID-19 crisis, but this may be the most important. You get analysis and you get prescription from, that's just wonderful stuff. Dr. Andrew Nish. He's the John Stoddard Cancer Center Medical Director. Doc, thanks for coming on the podcast again.
Hey, thanks for inviting me, and I've got lots more to talk about, so
we'll check back in.
Maybe we'll do it again.
Yeah, well, I got nothing but time. I'm here, so I'll ring you up. We'll do this again.
Lots to talk about as far as opportunity for how we do business in this world.
Yeah. Let's do that next. We'll come back here. Very short order. All right.
All right. Thanks, George.
All right, Doc. Dr. Andrew Nish.
Have a great day.
Thanks, pal. That's going to do it. Folks, if you like this, that makes you feel good, and I hope it does, follow Podcast by George on Facebook. Like us there and follow us on YouTube and Spotify, and God, we're even on the iHeartRadio app. We're on iTunes, and of course that YouTube thing's a big thing. Subscribe to that and ring the bell, and you'll get notified of each and every podcast as it comes down the line. But for right now, that's going to wrap it up. That's going to do it. That's another podcast by George.